The biggest myth about cavities is that if it doesn't hurt, you don't need to fix it. That is completely wrong. By the time a cavity hurts, it's now usually not a cavity, not just a cavity. It's usually a problem that involves much more extensive treatment than a simple filling. When bacteria in your mouth consumes sugar, the sugar produces acid, and the acid literally destroys the enamel that covers the outside of your tooth structure. And once it destroys the outside of your tooth structure, it goes into the tooth. There are lots of reasons that some people get more cavities than others. Some people are not as great as other people in brushing and flossing. Brushing and flossing, of course, are the best way to minimize the number of cavities that you get. Some people are not so great as others at watching their dietary intake of added sugars. The stronger the outside surface of your tooth structure, the less likely you are to have cavities. The more sugar you consume, the more likely you are to have cavities. Some people are just born with tooth structure that is less highly mineralized. It's not as hard and strong as the tooth structure in other people's mouths. For those people, no matter how much you brush or floss, no matter how much you constrain and restrict the amount of added sugar that you consume, you always manage to find that you have a couple cavities. There are some things that your dentist can do sometimes to counterbalance that natural tendency for your tooth structure to develop cavities. There are fluoride rinses, there are fluoride mouthwashes, there are fluoride treatments, lots of other things that your dentist can prescribe to help you make your tooth structure stronger to be less resistant to cavities no matter what you were born with. So the best thing to do is to see your dentist on a regular basis so that your dentist can identify cavities, identify them when they're small, treat them when they're small, before they become much, much bigger problems than you'd ever bargained for.